Good afternoon, and thank you for coming on such short notice. I am up here, I'm called you here today to share with you a very difficult decision that we've made regarding COVID-19. Today I'm issuing a public health order directing the closure of bars and limiting the capacity of restaurants. Essentially, this means that Knox County bars are businesses licensed to serve food and whose primary business is alcohol service will close for business until further notice. Restaurants who primarily just serve food will be being asked to reduce their table capacity to 50% of what they're licensed for. Restaurants that have an attached bar are being asked to reduce their bar service or their bar tables to 10% of what they're licensed for, and no standing at the bar, because people get close together when they stand at the bar, and also to reduce their table service to 50% of what they're licensed for. This does not impact takeout or drive-through service for food. That is allowed to continue under this order. And actually, food service is allowed to continue under this order, just in a different way. I know that this may increase anxiety and frustration about COVID-19, especially for those families and individuals affected by this order. Part of the reason this was such a hard order to decide to make is we realize the impact it will have on our families in Knox County. And that's a tough thing to think about. We encourage the larger community to continue supporting their favorite establishments, either by going in to dine there, by getting takeout, or buying a gift card to use later. We need to support these businesses through this very difficult time, and their employees who will also be impacted by this. Please understand and share with your audiences that this is not an order for businesses to shut down. Except for the bars, this is not an order for businesses to shut down. Rather, we're asking them to be patient and flexible in how they operate. And this could change, but this is the situation right now. The health department staff and other medical personnel are committed to protecting the health of this community. We encourage you to continue to exercise patience with them as they work to sift through information and instructions. They have families themselves, and while the rest of us are socially distancing in creative ways, they are on the front line. And for that, I'm incredibly appreciative and grateful. So when we look at the region around us, called the East Tennessee region, the 15 counties surrounding Knox, we have seen an increase in the number of cases of COVID-19 in those counties. In addition to that, we received notification from the Tennessee Department of Health in Knox County. We have 4 new cases that my staff are actively looking into and working. So given that information, I believed it was time for us to make another ask of our community, in addition to social distancing and different ways at work, to make this decision to change how people get together socially in restaurants.
And this applies to all of Knox County?
This applies to all of Knox County, yes.
Do people at home who are maybe not planning to go to the bars this weekend need to do anything differently as well?
No, people at home need to continue social distancing, frequent hand washing. This isn't a substitute for any of those things. Frequent hand washing. It's a good idea to limit handshaking. Try not to touch your hand or your face with your hands, and also stay home if you're sick, and avoid people who are sick.
Can you tell us anything about these new cases that have come up? Are they community spread cases, or are they still isolated incidents?
I do not have any information about those new cases at this point.
This order takes effect immediately?
This order takes effect today, yes, immediately. We don't. I put it in place. We'll evaluate it over time and decide when it's appropriate to lift it, and I'll issue another directive at that time.
Is there already a distinction between a bar that might serve food and a restaurant that has a bar?
Yes,
it
is already in the Tennessee Code defined.
Okay.
And so if you look at the language of the order, it uses that Tennessee Code language, and the establishments that fit that description know who they are, as do my staff.
What's the enforcement of
My staff will be doing spot checks to see if restaurants and bars are in compliance. If not, we will work with them to get into compliance.
Do you expect assistance from the sheriff's office in doing that?
I don't anticipate needing assistance from the sheriff's office to do that. We have a really great relationship with our restaurateurs. We inspect them regularly, and we're in there regularly and have a working relationship with them. And not to this scale, but on individual basis, we sometimes have to ask restaurants to close briefly because of a health violation.
Have you talked with partners in the restaurant industry about this decision?
We have not, but my staff will be talking with them and working with them. Again, they're the folks who have the relationship.
And remind us again, this is specifically for bars. For restaurants, you're asking them to reduce to 50% of their seating capacity. And restaurants and bars, there are specific.
Right. So if you're primarily a bar, if your primary service is serving, your primary business is serving alcohol, we're asking you to close. And if you think about the atmosphere of a bar, there's a lot of people in there. People stand at the bar. There's a lot of mixing and mingling. People standing shoulder to shoulder. If you are a restaurant that doesn't serve alcohol at all, we're asking you to limit your table service to 50%. If you're a restaurant that also has a bar, we're asking you to limit your table service in your bar to 10%. And no standing at the bar, so none of that gathering at the bar, and to reduce your table service to 50% in your dining room.
And I hate to be a stickler for wording, you're using the word ask. In this case, it's a public health order.
It is an order. It is an order. That's correct.
Can you help us put a picture as to what 10% looks like?
That depends on the establishment. So no, 10% of the seats they're licensed for. So it just depends on how many seats they're licensed for.
One more question?
Okay. Thanks, everybody.
Thank you, Dr.
Yep.
And Mayor Jacobson, we'll get a few words from you on this impact and the new cases. in the
Sure.
county, too.
I think it's important for us as a community to come together, and we're gonna have to take care of each other because I don't think this, when we talk about this order in a couple weeks, potentially it's going to be a lot longer than that. We're going to see a lot of people lose their livelihoods. We're going to see businesses go out of business. Nationwide, we're already seeing mass layoffs. We're seeing businesses lose their business. People will lose their life savings. This is going to put incredible pressure on any social services, not only government, but on all of us. So my message to everyone is that this, and despite the fact we have social distancing going on currently, as a community, we are going to have to take care of one another. We're going to get through this. There is light at the end of the tunnel, and we're going to be okay, and we're going to be stronger because of it. We have to take care of each other. Thank you.